Good afternoon, Minnesota, and thank you for joining us. Since we've been doing this for about the last 4 months, and I think now as we've come to understand the impact that COVID-19 has had on both us as a state and nation and globally, probably nothing in any of our lifetimes has been more disruptive. We have almost 150,000 of our fellow Americans dead, nearly 4 million infected. The rate of acceleration to get to that first million took a couple months, and then it took about another month to get to 2 million, and about 3 weeks to get to 3 million, and 2 weeks to get to 4 million, that these are the way pandemics work. And from the beginning, Minnesota, we said we knew this was going to be a long haul. We said in March that the darker days were ahead of us, and we promised a few things. We said we would use science and we would adjust as the science and the situation warrants us to do so. We continued to say that the health, the safety, and the well-being of Minnesotans was paramount. We understood that we were going to be balancing public health, individual health, and economic viability at the same time. We watched it burn through other countries, and here in the United States, unfortunately, we did not prepare necessarily the way we should have in terms of PPE, in terms of testing. In Minnesota, we said from the beginning, we were building for the long haul. We did not know if this would be a year, 18 months, or what it would take. We knew that the advent of a vaccine would be critical, and we knew that the longer we built time before people got infected, we would not overwhelm our healthcare system, and we would get better with the therapeutics. And I think that is starting to play out, that even as we start to see increasing numbers, we see fewer hospitalizations and even fewer ICUs, and we've been able to drop that critical metric number of people who are killed by COVID-19. And in following that science, we know it hasn't always been easy. It's been incredibly difficult across the country. The economic challenges that have been put to people, the changes in daily life, the missed graduations, the missed weddings, the not being able, as Lieutenant Governor said, to hug grandma. That has happened, and it has exacerbated mental health anguish. We are struggling with and figuring out, and we know we have to get our kids back in school. It's the safest and the best place for them to be able to grow as people, and we need to make sure that that safety extends to their physical health. And so amongst all those things, we've taken measures throughout the time to try and slow the spread of COVID, to try and purchase the things that were necessary, to try and change behaviors in a way that would keep Minnesotans safe. And today we're here to announce another one of those. We're going to announce Executive Order 2081 that will be a Minnesotans must wear a mask indoors, a masking mandate. Now I want to back up for a second on this. Yesterday, President Trump said the worst is yet to come on COVID-19. Pretty ominous, but I think for many of us, a statement that we made in March. I don't think the president's probably wrong as far as the country goes, but I think here in Minnesota, with this mask mandate and with the things that we have done previously to this, I think it is very possible for us to not have the darker days behind us, but for us to start moving forward. If we can get a 90 to 95% compliance, which we've seen the science shows, we can reduce the infection rates dramatically, which slows that spread and breaks that chain. And this is the way, the cheapest, the most effective way for us to open up our businesses, for us to get our kids back in school, for us to keep our grandparents healthy, and for us to get back that life that we all miss so much. We know that the three most critical things in slowing the transmission of COVID and keeping people safe is wearing a mask, washing your hands, and social distancing. The good news is those cost us almost nothing. And as we've seen across the country, businesses have led on this, local localities, and I want to thank those city councils and those mayors and those communities out there that had these debates and moved forward. We try and will continue to try to build the coalition necessary to make these types of steps just the way we do business. I think many of us remember when we moved to no smoking indoors. That battle waged for a while, and then it became the norm. Wearing seatbelts. Most recently, hands-free driving. Asking you not to use your cell phone and having a penalty involved if you should choose to do so, not to take away your freedom, but to protect your neighbor from you running into them or you killing yourself by being distracted driving. The mask mandate works the same way. We're going to have Commissioner Malcolm and Commissioner Grove explain some of the details around this, but this is a very simple one. This is one if Minnesotans choose to wear the mask. And just to be clear, we've got an effort to get out about 4 million masks to the Chamber of Commerce across the state, disposable masks. We'll make this easy for you. We'll make sure that the police are there and they have masks on hand. They would much rather give you a mask and have you wear it than give you a ticket. Because in the long run, this is the quickest way to ending the COVID pandemic. It is the surest way to getting us to the therapeutics and the vaccines with the least amount of impact on Minnesotans. And it is the absolute economic key to making sure that businesses are open and stay open. So this is a move that you'll hear the details about to go into effect on Saturday morning. You certainly can start today for that percentage of you, and it is a minority percentage that hasn't been wearing them into places. We'll certainly start on that today, and the sooner we do that, the quicker we'll start to see the numbers go down. The quicker we do that, we'll start to see businesses be able to open back up and stay open. And as I promised and asked and said that we would do, we would try and adjust as the situation adjusts, and our goal is to watch and be smart about strategic openings, all with the goal of not having to go backwards. And this MAP mandate should ensure that we don't have to do that. And we continue to look forward on the things that we can reopen and re-engage in the social life that we want to see. So with that, I'd like to have Lieutenant Governor Flanagan say a few words.
Thank you, Governor, and thank you, everyone, so much for being here. Our world changed dramatically about 5 months ago, and the crisis that we have faced has been certainly the most difficult of my lifetime, and certainly for many folks across the state and country. But I've also been incredibly moved by community and kindness. From donating over 7,000 homemade masks back in April, to taking to the streets to demand justice for George Floyd, to the thousands of hours and dollars that have gone towards the most vulnerable folks in our state during this time. That's who Minnesotans are. We have struggled together, we have learned together, and we have grown together. And among the things that we have learned is that homemade masks, while not a replacement for personal protective equipment, is one of the best ways that we can keep ourselves and other people safe. Masking limits the spread of COVID-19, and my mask protects you, your mask protects me, and when we both wear them, it keeps both of us that much safer. Today's announcement is the best thing that we can do to make public places safe all across the state. It's how we keep businesses open, it's how we socialize safety, and it's how we embrace a new normal in this moment. But above all, we do this because it will help save lives. 4 months ago yesterday, I lost my brother, Ron Golden, to complications from COVID-19. He had recently started treatment for cancer, and his immune system was compromised. To some, he was a statistic, the second person in the state of Tennessee to die from COVID-19. But to me, he was my big brother. And I share this with you today because the masking requirement, of course, will be an adjustment to towns and cities and counties across the state. But I share this with you because I want you to know how seriously we take this issue. In these towns and cities and counties that a masking requirement, has not, in these towns and cities and counties across the state where folks maybe haven't yet experienced COVID-19, that's where this masking requirement becomes even more important, so that the spread doesn't even begin in the first place, to prevent 1 or 2 cases from becoming dozens, and to prevent dozens from becoming deaths. Despite all we have learned, the virus is still unpredictable. We do not know yet what the long-term effects are. We cannot predict who may require hospitalization or ICU care. We do not have consistently effective treatments for those who fall seriously ill. The best thing that we can do to protect each other, especially those who are at high risk for severe complications and death, is from getting folks sick in the first place by wearing masks. I miss my brother every day. and we have not yet had the opportunity to come together to memorialize my brother. I pick up the phone regularly to send him a text or a cute photo of his niece, and then I remember that he's gone. So every death that we prevent is another family, another community that does not have to experience this kind of grief. I just want to be clear that we're not introducing this mask mandate to be a drag, or for some folks who may be separated politically on different sides of the aisle. I don't care what your background is, your political affiliation, your identity. I don't want your family to have to experience what my family has gone through. It's that simple. And wearing a mask is a way that we can do that together. Adjusting to wearing face masks may be a little uncomfortable, but you'll get used to it. They can be stylish and buffalo plaid. But it's also a way that we just show as Minnesotans that we care about each other. And I think that that's something that we're good at. So I invite Minnesotans to learn more about how to wear masks effectively and to make sure that we are doing everything possible to make this work together. It's worth it. And with that, I'd like to hand it over to Commissioner Jan Malcolm.
Thank you, Lieutenant Governor, for your warm heart and reminding us about what's behind the statistics. It's lives, our families, our friends, ourselves, our state. So thank you for that. Thank you, Governor. This is another important step forward in our fight against COVID-19 in Minnesota. And we know that everybody's tired of this. Everybody's wants to be done with it and wants to get back to everything that we are missing and have missed and to get back to normal. But as the governor and lieutenant governor have said many a time, it's going to be a new normal for quite a while, and we're going to be living with COVID-19 for quite some time to come. And wearing masks whenever we are not in our homes, whenever we are not just with our own household cohort, is one of the ways that we can best live with this together. I'm going to shorten up my remarks a little bit because we have some really important leaders in our community for you to hear from, but I do want to just share a little bit of the data with you and give you the high level of what is contained in the executive order. You know, until we have the weapons that the governor has talked about and the lieutenant governor, effective treatments and a vaccine, our best weapons against this are community mitigation and reliable information. A quick side note, we were gratified yesterday that Minnesota is on the right track when it comes to having the information that we need to fight this virus. An analysis by a national nonprofit headed by the former Centers for Disease Control Director, Tom Frieden, ranked Minnesota as the best among the 50 states in our reporting of key COVID-19 data. We know there's always more work to do to get the right data and to make it accessible to the public and to decision makers. And we'll continue that work, but we were really gratified to see that the work we have done to date is validated and appreciated by national public health leaders. With regard to community mitigations, the governor said it, the big three, we know what they are: social distance, avoiding crowds, avoiding close sustained contact, hand hygiene, and masking. We can do this. We've learned so much more in the last few months, and we recognize that there were some mixed messages early on about whether masks worked or not, or in what situations they might be valuable, and who should wear them and who didn't need to. But we've learned so much more in just the last few months, and the evidence has really gotten compelling. We know how the virus is spread. We know that it can be transmitted much more than we thought at first, simply by normal speaking, much less loud speaking, singing, chanting, partying, the things you do when there's a lot of noise in the atmosphere or when it's part of the activity that you're doing. So masks help to control the spread of the virus through the droplets and the aerosols that literally come out of our mouths. The journal Health Affairs recently published a very thorough study that reported to what degree masks reduce the rate of spread of COVID in terms of cases and eventually deaths. And according to that publication, states that have mandated face masks have seen a greater decline in their daily growth rate. And these measures nationally are estimated to have already averted between 230,000 and 450,000 cases of COVID-19 to date by those who have worn masks either under mandate or voluntarily. At the end of June, Goldman Sachs shared an analysis projecting the amount by which further masking would slow COVID transmission and even save our country significant percentage points in GDP as compared to having to shut down the economy again to stop this tidal wave. Forbes just published an analysis comparing 21 states that had a form of mandatory mask policy with those that did not. The average increase in new COVID cases over the previous 14 days in those states with a mandatory mask policy was 16%. In states without a mask mandate, the average rise in new cases was 79%. There have been recent national estimates showing that whether we do or don't succeed in hitting that 95% public compliance with mask wearing between now and the end of the year could mean the difference in quadrupling the number of deaths that are projected in our country by the end of the year, whether we continue to socially distance and whether we wear masks. These are not trivial improvements in slowing down the rate of disease and ultimately death. And as the Lieutenant Governor said, we're doing this to protect each other. We've been saying for months now, I wear a mask to protect you, you wear a mask to protect me. Even for those among us who think we may not be at serious risk of illness, we have to remember that as many as 40% of all people with COVID-19 do not show obvious signs of illness during the time that they can transmit the virus, yet they still can pass that infection along to someone at higher risk. And no one wants to take that chance with a friend or a loved one. And while it's true that older people and people with existing underlying health conditions do tend to get much more severe disease, we've seen plenty of evidence in our own state that this disease can be deadly and very serious for younger people and for those without any known complications. And we're also learning now about very serious health consequences that emerge later on, months later in some cases, in people who had very mild cases of illness. So none of us should think that we are immune ourselves from severe consequences of COVID-19. But again, the key consideration here, because of the fact that so many people can spread this without knowing that they're infected, that is the reason that CDC says it's so important that masks be worn by everyone, essentially everyone, in public settings or when around others outside of their own immediate households. And we've known, as the evidence has been growing, that this would be a good thing for people to do, and we've been strongly recommending that people use face coverings since April. But in recent weeks, as we've seen more of this evidence, as we've seen the results of the difference that mandating the mask makes, the governor has chosen to take this next step for Minnesota. As of Monday, 28 states, including Washington, D.C., plus Washington, D.C. and Puerto Rico, had implemented face coverings. I know a couple more just did today. More than a dozen cities in Minnesota have implemented this, including really all of the major population centers. But with today's order, the governor is extending this population to all Minnesotans and helping to create a consistent expectation for all of us, helping to normalize this critical behavior to live with COVID, as the Lieutenant Governor so eloquently said. So as of essentially midnight on Friday, Saturday morning at 12 a.m., Minnesotans must wear a face covering in indoor businesses and indoor public settings. Workers must also wear face coverings outdoors when it is not possible to maintain social distancing. The order is quite detailed. It lays out a number of specifics which are contained in the executive order itself and are also posted on the Stay Safe Minnesota website. And on the Health Department website, we have a frequently asked questions document, which is just going up. That details the circumstances under which mask wearing is mandatory versus when it is strongly suggested, when it's okay to remove the mask temporarily, and it also spells out who is exempt from this order, including people with certain medical conditions or people with some forms of physical and mental disabilities, as well as children under 5. So in order to be effective, a face covering must be worn in such a way that it covers the nose and the mouth completely. There's a wide range of types of masks that are effective, including paper or disposable, cloth, scarves, bandanas, neck gaiters, or religious face coverings. And there's plenty of guidance out there about where to get masks and how to make homemade masks. So we also, as I mentioned, there are a number of settings which are exempt from the governor's order, but may be subject to specific rules for those settings, specifically tribal nations, the judicial settings, and the like. The specifications around those with medical and mental health conditions or disabilities are laid out in the executive order. It's about really excluding people from this requirement who have conditions that compromise their ability to breathe. But in those cases, people are urged to consider alternatives to face coverings that might be suitable for them, including clear face shields and certainly, again, further limiting their contact with people outside of their home. For children 5 years old and under, those who are under 2 years old really should never wear face coverings due to their higher risk of suffocation and people not able to see what's happening with them. But it's a good idea, even though the exemption applies to under 5, for those above 2 to wear face coverings if they can as well. There are specific guidances that have been in place for preschool and pre-kindergarten and K-12, higher education, that are all spelled out in the guidance as well. So within the school and higher ed environments, there will be requirements there laid out for students, staff, and other people in those settings. But in the interest of time and to turn this over to other speakers, I will forego detailing those, but I do want to end by saying we appreciate very much that the statewide mask policy was a strong desire of many stakeholders. You'll hear from some, including the Minnesota disability community. And we want to thank the Council on Disability for their advocacy on this issue and to reaffirm our support and our commitment to our neighbors who are at risk and who have underlying medical complications. And I do want to acknowledge that cloth masks are a challenge for Minnesota's deaf and hard of hearing population, and that we ask everyone to be considerate and accommodating of our deaf and hard of hearing community. For example, having transparent face masks on hand or having alternate means of communication available, like note writing or video sign language, is a great accommodation that businesses and organizations can offer.